In this video, I will discuss Campylobacter. Campylobacter is a gram-negative curd or spiral-shaped bacterium, and it mostly causes gastroenteritis. Gastroenteritis and diarrhea is mostly bloody in nature. One of the most common causes of bacterial gastroenteritis worldwide and main species are Campylobacter jejuni, that is very important, and Campylobacter coli. Campylobacter jejuni is important. Microbiology. These are curved, or S-shaped rods, and these are gram-negative. These are motile, have darting motility with a single polar flagellum. Darting motility with a single polar flagellum. Epidemiology. Its reservoirs are poultry, cattle, dogs, and cats. It transmits through contaminated food, especially undercooked poultry, because poultry is a reservoir for this Campylobacter jejuni. And when patients come to us with GBS, they mostly have history of eating undercooked poultry. So it is a risk factor for GBS, Guillain-Barré syndrome. Unpasteurized milk, contaminated water, and direct contact with infected animals or feces, these are all reservoirs for this Campylobacter jejuni, and through these transmission of Campylobacter jejuni can happen. Pathogenesis. When you ingest the organisms, there is colonization of these organisms in the small intestine and colon. These cause inflammation in the small intestine and colon and lead to ulceration. That's why it is bloody diarrhea or dysentery. Produces cytotoxin and enterotoxin leading to diarrhea. It has a low infectious dose because only 500 organisms can cause gastroenteritis. The incubation period for this organism is 2 to 5 days, and symptoms include fever, malaise, headache. Like other infections have these symptoms, fever, malaise, and headache, but it causes abdominal cramps, watery or bloody diarrhea, but abdominal cramps, bloody diarrhea, nausea, vomiting. These are important for Campylobacter jejuni. It leads to abdominal cramps, bloody diarrhea, and nausea and vomiting. But fever and malaise and headache, these are mostly seen with other infections too. Duration. Its duration is usually 1 week, and the complications seen with Campylobacter jejuni are Guillain-Barré syndrome, GBS, in which you have autoimmune polyneuropathy. That is, your immune system causes demyelination of your peripheral nerves, leading to paraplegia, and this can progress to involve other muscles, leading to respiratory distress and therefore death. Then reactive arthritis, bacteremia, irritable bowel syndrome, IBS, can also be seen post-infectious after Campylobacter jejuni. How will you diagnose this? You have to go for stool culture, but on selective media. For example, Campylobacter or Scaros medium. Gram stain shows curved motile rods. These are gram negative. PCR or antigen detection tests can be done, but these are not done routinely. Treatment. It is usually self-limiting and therefore supportive care, like for diarrhea, IV fluids, electrolytes imbalances are corrected, and also antiemetics can be given for vomiting. Antibiotics are given for severe or prolonged cases. Previously, ciprofloxacin was the drug of choice. Now azithromycin is the drug of choice, and it is used for the treatment of Campylobacter jejuni. Prevention. As I have told you, poultry are reservoir for this bacteria. Therefore, you have to go for proper cooking of poultry. Avoid unpasteurized milk and untreated water, and good hand hygiene as for every infection.